Hi, I'm John Goodman, and I want to tell you about an alternative to Obamacare. It's called the world's greatest healthcare plan, and it's been introduced in the House by Representative Pete Sessions, who is chairman of the very powerful Rules Committee, and in the Senate by Bill Cassidy, who is probably the most knowledgeable person on healthcare in the Senate. This is a bill that starts by identifying all the major ways in which government screws up our healthcare system. I believe that every major problem we're having in healthcare is caused by bad government policy, and most of those bad policies originate with the federal government. For example, for most of modern history, we've actually encouraged people to be uninsured. If you don't get health care from an employer or from government, for most of the last 20, 30 years, you had to pay out of your own pocket with very little subsidy from the federal government. On the other hand, if you decide to be uninsured, you go into a hospital and you can't pay your bills, well, the rest of us will pay those bills for you. We've encouraged uninsurance instead of insurance. We've encouraged public insurance instead of private. If you qualify for Medicaid or for CHIP program, you enter and you pay nothing. On the other hand, if you buy private insurance, the government, again, does nothing to help you out. We encourage group insurance rather than individual insurance. If you get insurance through an employer, there are generous tax subsidies there, but again, if you buy on your own, you get virtually nothing. Now, in the Obamacare exchange, there are subsidies now available to lower income folks, but if you make a decent income, you don't get any subsidy under Obamacare. We have encouraged third-party insurance instead of self-insurance. For most of the post-World War II period, every dollar the employer paid in premium was a dollar that escaped income taxes and payroll taxes. But employers were not allowed to put money in a health savings account. We changed that about 20 years ago, and so now it's different. Now you can have an account, but there are far too many restrictions on it. We're still encouraging people to give all their money to the insurance company or to the government or to the employer, rather than doing what many people are capable of doing, managing some of their own healthcare dollars on their own. And finally, government has totally screwed up the market for risk. What we're finding in the Obamacare exchanges is a race to the bottom, where the insurers are going for very narrow networks to exclude the best doctors and the best hospitals. They're trying to attract the healthy and avoid the sick. And after enrollment, they're trying to keep the healthy because they make a profit on them, and drive away the sick because they never wanted them in the first place. Now, what we've done in the Sessions-Cassidy Health Reform Bill is correct every one of those perverse incentives that's caused by bad federal policy. Every one of them goes away. And along the way, we meet the three promises, the three broken promises of Obamacare. And what are they? Universal coverage, cost control, and real protection for people with pre-existing conditions. We don't have universal coverage under Obamacare, but under Sessions-Cassidy, there's no reason for anybody to be uninsured. For the first time since World War II, the tax law is going to give employers and employees new tools to control health care costs. And every dollar they save in their health care plan is a dollar they get to keep. And we're going to end the race to the bottom in the Obamacare exchanges. We're going to create a real market where health plans can specialize in heart disease and cancer and other problems, attract people who have those problems, and create centers of excellence in order to provide high-quality, low-cost care. And we do all of this by remaining true to traditional Republican values. And what are those? Choice. You choose a plan that meets your needs rather than government's needs or special interest needs. Fairness. We treat everybody the same. Bill Gates and the guy who mows Bill Gates' lawn are going to get the same tax credit under this bill. Everybody is treated the same. Under Obamacare, people at the same income level receive subsidies that can differ by as much as $10,000. All that goes away. Jobs, all the anti-job provisions of Obamacare go away. Portability. This is what people want most in a health care plan provided by an employer. Under Obamacare, there are huge fines if employers buy individually owned insurance for their employees, insurance they can take with them to the next job. All that's going away. We actually, in this bill, encourage employers to buy for their employees insurance that they own, they can take with them from job to job and in and out of the labor market. So this is a bill that did what Obamacare should have done 6 years ago. It solves problems, and it does it in a way that improves healthcare, lowers costs, raises quality, and minimizes the role of government. Government's involved, it gives a generous tax subsidy to people to buy health insurance, but then it gets out of the way and lets the healthcare system evolve in a way that's based on individual choice and competition in the marketplace.